My name is Jamie and I'm a nursing student, and today I'm going to be demonstrating trach care using my general principles and safety practices while following my 11 medication rights and 3 safety checks as necessary. I would begin by knocking and entering the patient's room and introducing myself to the patient. I want to provide privacy and identify my patient using my 2 patient identifiers, their name and first and last name, date of birth, and check it to their wristband. And then I'm going to want to explain the procedure to the patient and why we are doing it. I'm going to assess my patient for any pain at the moment, their pain level. Right now my patient's not feeling any pain, but if they were, we would want to treat it first. I have my patient up at an appropriate working level with their head elevated 45 degrees, and I would want to assess to make sure that they don't have any allergies either before I get started. So everything is squared away, the patient has no pain or allergies or anything, so we are good to begin. So I would start by performing my hand hygiene. I'm going to take this off my wrist. Performing my hand hygiene, and then I'm going to put on my clean gloves. And I'm going to go ahead and set up my area. My sterile field is going to be my box today, so I'll just and I'm going to go ahead and pour in some of my normal saline and lip it. Alright, so while I still have my clean gloves, I'm going to go ahead and remove the old gauze. And I'm going to remove the old cannula. Perform my hand hygiene, and then I'm going to apply my sterile gloves. Alright, so now we're going to take the inner cannula. I'm going to use my non-dominant hand to stabilize the faceplate, and use my dominant hand to insert the cannula. So still stabilizing the faceplate, I'm going to grab my sterile Q-tip, dip it in my saline, and we're going to just clean around the stoma. Alright, I'm going to use my already non-sterile hand to adjust that gown a little bit more before I start drying. I'm going to grab my sterile gauze. You want to make sure to not touch the inner cannula the whole time. You want to keep it sterile. And then we're going to place the gauze underneath.
I tried to do the tripod. It's very fidgety. So I did the tripod, started it, walked all the way over here. He sat here, and I was like, "Hi, my name's Getty." So I made it look like it was a swim pool.
Stick it under the faucet and go guzzle guzzle. It'll help you poo. It'll help you poo. Everybody needs something to get respiration. It'll help with your.
Do you need it to see that?
It has to be able to see this.
There we go. And now we're going to replace the collar, and you could do that with 2 person or 1 person, but with just 1 person, I would want to keep the old collar on while I put the new collar on.
Yeah.
Then remove it.
I mean, come on.
I'll set up a little bit more. So while keeping the old collar on, I'll just stabilize the faceplate and move that old strap out of the way.
Is that good? Or not?
steps in a trach. First off, I'm going to do my general principles and safety practices. I would have a mask and goggles on for this skill, but for right now, for video purposes, I don't have a mask on so you can hear me, and I'm using my glasses and goggles. First off, I'm going to wash my hands.
And then we would remove the old
To
one.
assess my patient for, I'm going to do a respiratory assessment, assessing the lung sounds and
It'll heal that right
respiration.
up.
And their O2 stack. And then I am going to also assess for anything. First off, I would go ahead and place the choke down, just to make sure that nothing gets
Keep that
on
on
the
it.
patient.
Carmack's a little bit further.
Now I'm gonna set up my,
It's probably part of your anxiety.
it gets worse.
There we go. And then whenever I get the new collar on, I'd want to make sure I can fit one finger underneath to make sure it's not too tight. And then I'm going to reassess my patient's pain to make sure that they are still okay. Before the procedure, I would have established a sign between me and the patient for them to let me know anytime they feel any kind of discomfort or pain. And throughout the procedure, they handled it or tolerated it fairly well, so there was no signs of distress or discomfort. Patient's still not feeling any pain or having any complications. So then I would want to lower the bed to an appropriate setting, clean up my environment, make sure they have their call light, and I'm going to provide them privacy and exit the room to report and record.